Today, we are going to tell the story of syphilis, where it came from, how it ravaged the world, why it's surging again in the US, and how neurosyphilis can mimic schizophrenia, bipolar disorder, even dementia. Welcome back to another episode of Psychiatry Rewritten. My name is Lane. The first explosive European outbreak hits in 1495 during the Italian Wars. Contemporary accounts describe a horrific new disease that disfigures and kills people within months, far deadlier than today's version. They didn't know it yet, but that disease was caused by Treponema pallidum, which is a bacterium. Where did it come from? Historians long argued Columbian versus pre-Columbian origins. Archaeology and phylogenetics now largely support a New World origin with rapid spread to Europe in the late 15th century. It was first identified microscopically in 1905 in Berlin. Researchers found these spiral-shaped bacterium under their microscopes. The name syphilis comes from a 1530 poem about a shepherd named Syphilis who offends Apollo, and the branding stuck. Treponema pallidum has subspecies that cause different related diseases. Syphilis, which is a subspecies, pallidum, the one we're talking about, yaws, Bajil, and Pinta. So, Treponema pallidum subspecies endemicum is unlike venereal syphilis because it is usually spread through direct non-sexual contact, often among children. It's usually like a childhood disease, and sometimes it can be contracted, spread through shared utensils like forks, spoons. Historically found in arid climates and arid regions of the Middle East and North Africa. So that one starts with sores in the mouth and mucous membranes, and then it later progresses to skin lesions, bone, and cartilage damage, especially to the nose and the palate. This causes facial disfigurement if it is left untreated. Because it's not an STD, it's not a sexually transmitted infection, it's more a disease of childhood close contact in impoverished populations, impoverished settings. And there's Treponema caritium, which is very close cousin of pallidum, but it is spread by direct skin-to-skin contact. It's mainly in Central and South America, historically in rural, warm, humid areas, and it's limited to the skin only, unlike the other two types of syphilis that we discussed. It's not like pallidum. It doesn't affect the internal organs at all. It does cause scaly, reddish, or bluish patches on the skin. Over time, it can lead to areas of depigmentation, which is just a loss of pigment of your skin, leaving striking, pretty noticeable light, dark patches, the contrast from where the pigment loss occurred. And it's considered the most benign of the treponematoses, but can still be socially stigmatizing due to visible skin changes. Like kids can still be made fun of or alienated for the way that their skin looks due to this bacterium. Okay, I'm getting off topic, but the point is it shows that Treponema pallidum can cause more than just the typical syphilis infection that we might think about if you think about it at all. So all of these types are extremely similar, almost 99% the same, but they present much differently, which is what's interesting. Basically, syphilis is just a subspecies under a larger treponemal umbrella. From battlefield camps to brothels to royal courts, Treponema pallidum threaded itself through human history, shape-shifting across stages and sometimes burrowing into the brain. Syphilis didn't just shape medicine, it shaped history. Nietzsche wrote philosophy under its shadow. Schubert composed symphonies while dying of it. Al Capone, the most feared gangster in American history, spent his last years in a fog of neurosyphilis, playing with toys like a child. From poets to politicians, this disease quietly rewired the course of art, war, and power. So you get syphilis through sexual transmission is the most common way. Direct contact with a syphilitic sore or a canker sore or a rash. These sores are often painless and they can be on the genitals, the anus, the rectum, the lips, or inside the mouth. So they're easy to miss for the person who has them and for somebody who is looking for them in a partner. If they were, checking to see if they could see that, it's easy to miss. Transmission happens during vaginal, anal, or oral sex. So you can get it through any means of sex, and you can also get it through blood exposure, which is rare today because of so much screening and prevention that we have, but historically it was spread via blood transfusions or shared needles. Treponemas can survive in freshly drawn blood for a short time, actually. There's also vertical transmission, which is congenital syphilis, which means pregnant women with syphilis can pass the bacteria through the placenta to the fetus. This can cause miscarriage, stillbirth, or severe congenital infections in their newborn babies. Congenital syphilis has been making a scary comeback in the US in recent years. Treponema pallidum enters through tiny breaks in the skin or the mucous membranes. So think about just a tiny little abrasion opening in the skin. Because cankers are painless and can be hidden inside the cervix, rectum, throat, people often don't know they're infectious. Even the secondary stage rash, often on the palms and the soles of the feet, can shed bacteria. That's why syphilis is sometimes called the stealth STD. It's a stealthy survivor. And the name The Great Masquerader applies not only to its symptoms, but to how it hides at the point of transmission. Painless, invisible lesions mean people don't realize they're contagious. Unlike gonorrhea or chlamydia, syphilis doesn't always burn, itch, or hurt at all, which historically has let it spread under the radar. The rise of congenital syphilis today is a major public health warning. Many pregnant people never even knew they were infected until complications during birth appeared. Some scary things I read about this were some of the early prevention attempts at syphilis. which were condoms before condoms. So in the 1500s, the Italian physician Gabriel Falloppio, which is the fallopian tubes guy, evidently, described linen sheaths soaked in chemicals as a way to prevent the French disease, syphilis. These early condoms were tied on ribbons at the base. Later versions used animal intestines like pig intestines or bladders, like sheep gut condoms were popular in the 18th century. They weren't just for pregnancy prevention either. They were marketed as protection against syphilis. Another way that we tried to prevent chemical washes early on was people using herbal or vinegar rinses after sex, believing they could wash the syphilis away, wash the infection away. Mercury compounds like mercury chloride were also applied topically as a prophylactic, which 100% poisoned people instead. And often poisoned people instead. Some treatments were worse than the disease, like mercury. They said a night in the arms of Venus leads to a lifetime on Mercury. The most infamous treatment, though, from the 1500s to the 1800s. Mercury was applied as ointments. It was fumigated in steam baths or even ingested. Side effects. I just thought about a yoni steam bath with mercury. Side effects included tooth loss, mouth ulcers, neurological damage, and death. But since syphilis itself could disfigure and kill, people kept using it. And then there's the holy wood cure, which was brought from the Caribbean in the 1500s. Patients were made to drink concoctions or sweat heavily after ingesting it. And it didn't work, but it made European colonizers feel like they'd found some exotic miracle cure. And then there were arsenic-based drugs. They were trying to knock it out. Arsenic-based drugs in 1910 was the first real scientific breakthrough. Finally. Paul Ehrlich's salvarsan was nicknamed the first magic bullet. It worked better than mercury, but it was still toxic and had to be injected repeatedly to get efficacy from it. The turning point was penicillin in 1943, and it changed everything. It was safe, effective, and quickly became the gold standard for syphilis treatment. For the first time in centuries, syphilis was curable without toxic side effects. So, after the initial infection, the T. pallidum gets into your bloodstream and your lymph system, it travels through your body. So it starts to travel through your bloodstream, and it has this like weird corkscrew shaped body shape. It is a weird corkscrew shape, and it moves really quickly and easily through your body. So it has high motility. And because of this, it can cross your blood-brain barrier and go into your brain, and there it starts to attach to the lining of the blood vessels in your brain, and then it lives there. And it can cause inflammation and Other disruptions you can imagine could be a little bit. It can also hitchhike and cross into the central nervous system as well. T. pallidum bacteria is, like I said, a stealthy survivor. This is partly because it has few exposed outer membrane proteins, so the immune system has trouble even recognizing it. It has a slow replication rate as well. It only replicates once every 30 to 33 hours, which is different because many bacteria replicate every couple of minutes, right? So this is only every couple hours, making it harder for antibiotics and immunity to clear it. It basically sets up a part-time job in the CSF fluid, in the cerebrospinal fluid, and in the neural tissue. It's patient. Early neurosyphilis, like we're talking in the first months to years, is like meningitis, infection, kind of a vibe. Cranial nerve palsies, strokes from inflamed blood vessels. And then in late neurosyphilis, which would be decades later if it was left untreated, then comes the general paresis, which can start with the psychiatric symptoms like mania, psychosis, dementia. And that's what we're getting at today. We're getting to tertiary syphilis. There's degeneration of the spinal cord pathways, causing lightning pains, ataxia, and bladder control issues. It can cause urinary incontinence. This is where the syphilitic madness reputation comes from in history. People deteriorating with bizarre psychiatric and neurological symptoms. T. pallidum is one of the rare bacteria that can cross into the brain very early and easily and just sit there quietly. That makes syphilis one of the great mimickers. It might look like schizophrenia, dementia, or stroke years later. In a way, it's like a ghost tenant. It's like dormant. It like sneaks into the brain when the house is new, and then decades later starts wrecking the place. That stealthy invasion plus the psychiatric presentation is why neurosyphilis still shows up on psych workups when someone has sudden, unexplained psychosis or dementia, especially during a time in their lives where it wouldn't normally fit. Because psychosis typically occurs, mania typically occurs for the first time in your early 20s, late 20s, early 30s, not decades later down the line. It's odd. Some well-known figures who were thought to have syphilis, and the list is much more extensive than this, but like I mentioned before, Al Capone, who was one of the American gangsters from Chicago, he contracted syphilis as a young man and never completed treatment. So by the time he was in prison in the 1940s, he had advanced neurosyphilis that left him cognitively impaired and childlike. As I said earlier, he would play with children's toys. He spent his final years confused and debilitated before dying in 1947. Oscar Wilde was widely rumored to have contracted syphilis while at Oxford. His prison health collapse has been linked by historians to tertiary syphilis, though some debate still exists. Another individual is Adolf Hitler. There are theories based on medical notes from his physician, Theo Morell, that Hitler may have had syphilis. It's speculative, but historians debate whether his cognitive decline, whether neurosyphilis contributed to his paranoia and cognition and overall decline. There's also Vladimir Lenin. Autopsy reports mention neurosyphilis as a possible cause of death or as a possible contributor to his strokes and cognitive decline, though arteriosclerosis was also diagnosed. And that's a leading cause of strokes. That's heart disease in America. Like plaques. Arteriosclerosis is just plaques in your blood vessels. So neurosyphilis can occur at any stage. And that's the crazy twist. Neurosyphilis can occur at any stage, not just the classic tertiary box that we kind of learned in school. And neurosyphilis can present with those psychiatric symptoms at any stage. This is important because, like I said, if you see somebody outside of the regular age range with sudden psychiatric symptoms, psychosis, mania, it's something to consider. Neurosyphilis can look like a personality change, depression, mania, psychosis, cognitive decline, delusions, hallucinations, irritability, sometimes catatonia-like states. Later or concurrent clues are ataxia, Argyll-Robertson pupils, strokes in the young, and ocular or otic symptoms. An example case would be a 28-year-old with new onset paranoia and auditory hallucinations. The treatment team starts antipsychotics, but he also has headaches and a weird non-pruritic rash that he thought was just allergies. But an RPR comes back reactive at high titer. His CSF shows elevated protein and reactive VDRL. The diagnosis is neurosyphilis, which is a treatable imitator to psychosis. So basically my point here is if it's a sudden, atypical, or accompanied by neuroocular or signs or risk factors, screen for syphilis. It's low cost, high yield, and missing it changes a life trajectory. So yes, the US has seen a major resurgence of syphilis. CDC's 2023 surveillance called for 3,882 congenital syphilis cases, including 279 stillbirths, infant deaths, the highest since 1992. The congenital rate rose 3% versus 2022 after years of 30% decrease annual jumps. Broader STI trends show some recent signs of slowing in 2023. Declines in gonorrhea and primary and secondary syphilis were down 10% in 2022. But congenital syphilis remains alarmingly high. Media summaries highlight that syphilis rates are the highest since the 1950s, with disproportionate impact in marginalized communities and a dramatic rise in congenital cases over the past decade. So in translation, syphilis didn't go away. We just stopped looking hard enough for it. There are underfunded clinics, reduced screening, and care gaps in pregnancy, which opened the door for us to drop the ball. And I've seen syphilis that has caused psychosis since I've been a nurse. That's what makes me think about this kind of stuff. I see things and then I think about it. And nobody understood at first what was happening or what we were witnessing until it got to a pretty desperate point. The treatment for neurosyphilis is IV penicillin-based regimens, that's what the CDC recommends, for 10 to 14 days. Alternatives exist for specific circumstances, but penicillin remains the first line. And it's kind of like, this is one of the rare times in psychiatry where an antibiotic can reverse a psychiatric presentation. So it's kind of like, don't drop the ball. Don't miss that window. And another myth is that neurosyphilis is only in old men with tertiary disease. But the truth is that neurosyphilis can appear at any stage and at young ages, sometimes first as psychosis, especially in the context of rising community prevalence. Another myth is if there's no genital ulcer now, it's not syphilis. But the canker heals. The later stage, you have to remember the syphilis, the T. pallidum traveled into the lining of the brain. So even though the canker sore heals, later stages can look dermatologic, systemic, or psychiatric, but screen them anyway. Syphilis is a master of disguise. In 1495, it rewrote European medicine. In 2025, it's rewriting ER differentials and psych intakes. If someone's first psychosis arrives with odd neurosigns or simply arrives out of nowhere, a few tubes of blood could change everything. Because sometimes the schizophrenia in front of you is an infection with a cure. Okay, that's all for this topic today. Thank you for being here, and we'll see you next time. Bye.